Hello, welcome to your favorite health program right here on Ebru TV. You're watching My Doctor Show, and my name is Purity Museo. Now, 31% of men globally have a problem with their sexual functioning. They suffer from sexual dysfunction. We are talking about erectile dysfunction, premature ejaculation, and so forth. This dysfunction problem is usually associated with some medical and also psychological problems. Today on our show, we talk about sexual dysfunction in men. We will be looking at what could go wrong, what could be the problem, is there a way out, what are some of the treatment options there are. You're welcome to be part of the show. Call us live. The number is displayed right at the bottom of your screen. Use the hashtag MyDoctor to speak to us on Twitter at Ebru TV Kenya and at Purity_Museo. Use the same hashtag to talk to us on our Facebook page, which is Ebru TV Kenya and Purity Museo. For now, sit back, relax, and learn from the exciting show ahead. On the show today, our topic of discussion is sexual dysfunction in men. Talk to us. We have an expert who will be helping us just understand what the problem is and how it can be addressed. And now help me welcome our special guest today, Dr. Willie Otele. Welcome to the show, Doc. Thank you so much for coming. We appreciate it.
Thank you. It's a pleasure to be here.
And now just tell us, when we talk about sexual dysfunction, what is sexual dysfunction, and does it only affect men, or do we have same cases for women?
Thank you, Purity, for that question. I think it's imperative for us to open up this discussion with a working definition. First, what is erectile dysfunction? Erectile dysfunction is defined in many ways, but the commoner definition is failure to achieve and sustain an erection that is commensurate with mutually satisfactory sexual relationship. So the catchword is failure to achieve and to sustain. And then that relationship, as a product of that achievement and sustenance, must be mutually satisfactory.
And when we talk about sexual erectile dysfunction, is it just one of the types we have for sexual dysfunction in men, or do we have other types? Because I do understand there is usually another problem like premature ejaculation. Is it also a dysfunction?
Yes, yes. In fact, there are lots of dysfunctions. So we just look at them as erectile dysfunction or sexual dysfunction. But there are different categories or subdivisions or classifications. For example, there's premature ejaculation. There's also prolonged erection and failure to achieve ejaculation. There's also the problem of ejaculation in the reverse direction, what we refer to as retrograde ejaculation. And then there's failure to achieve and sustain erection.
Right.
So there are different categories of sexual dysfunction.
Yeah. And Doc, what would you say the prevalence of sexual dysfunction in men is like currently, either globally or in the country?
Starting with the home front, we do not have statistics that I can fall back to, but from some of the reports that we have come across, the estimate is about 50 to 52% of men are not able to achieve and sustain an erection for mutually satisfactory sexual relationship. At global level, it's estimated that between 10 and 20 million Americans have this kind of problem of erectile dysfunction. So 10 to 20 million, almost like up to almost half of the population of Kenya.
Yeah, and now just before we could narrow down to sexual dysfunction in men, do we have a sexual dysfunction for women as well?
Yes, indeed. The physiology or the normal body function for the human being is basically the same, either way, either in male or female. So we have it also in female, we have it in male as well. So it's not like the domain of males alone. Even females suffer from this kind of condition.
Yeah, and we'll have some time to just talk about sexual dysfunction for females. But now let's get back to a topic of discussion, sexual dysfunction in men. What are some of the sexual-related problems that we see in men?
Yeah, we basically mentioned, we've seen the problem of premature ejaculation. Of all the sexual functions, if we look at them broadly speaking, this is the commonest by and large. almost taking close to 50%. Then it's followed by other issues as a weak erection or a prolonged erection that does not lead to ejaculation, or ejaculation in the reverse direction, or just failure to obtain a sexual, to respond to a sexual stimulus and achieve an erection. Yeah, so those are some of the conditions, and they have different causes.
Yeah.
There are various causes, which we shall go into in the due course.
So we look at them one by one. Let's begin with what you're saying is the most common, premature ejaculation. What is premature ejaculation, and what is the cause for that?
Premature ejaculation is ejaculation that comes outside the requisite time. Requisite time, ejaculation ideally should take an average of about 10 to 15 minutes. If it comes earlier, in fact, specifically if it comes less than 2 minutes, then that is preterm or premature ejaculation. Yes.
So what are the possible causes for premature ejaculation?
For most of this, and may I say from the outset that it generally afflicts very young people, a younger segment of the society, and mainly it is due to stress. It is psychological. The psychological, where it comes in is the fact that there's something they call performance anxiety. Some of them have performance anxiety, so they have anxiety. Some of them have stress related to their lifestyle. Some of them have depression, and some of them have like unorthodox socialization habits. So these are some of the things that play into the hands of this condition.
And other than saying that once an ejaculation is less than 2 minutes, then that there's a problem, what other signs? Are there some signals that, you know, I think I'm having a problem with my ejaculation?
Yeah, if he has a problem with ejaculation, first of all, he's an anxious person. And if he has a visual stimulus, for example, he tends to respond to it even in an appropriate situation, even like where the partner is not available. He would tend to respond by having immediate arousal, and that immediate arousal would end up in ejaculation that is taking a very short time.
Yeah.
So they tend to get quick arousal in inappropriate circumstances. So those are some of the earlier signs.
Yeah, and can it be addressed? Do we have a treatment for that?
Oh, indeed, indeed.
Yeah.
There are many treatment options. The first one is called psychotherapy, where sex therapists or a urologist, for that matter, can be able to assess, evaluate, get the history, and evaluate and confirm what the problem is. Then thereafter, give psychotherapy. Psychotherapy treatment options aimed at treating, taming, getting hold of the mind so that the mind can comply, can behave in a normal rather than in an abnormal way. And if that fails, there's a drug therapy that can also be used. There are certain drugs. There are substances called neurotransmitters, which facilitate transmission of impulses, nerve impulses across the nerves. So these drugs are aimed at reducing the strength or the concentration of those neurotransmitters to slow down, to curtail, to reduce the rate at which the sufferer of this condition is firing the nerve impulses and therefore leading to quick ejaculation. We often also refer these patients to a sex therapist to teach them like performance of the sexual act in different positions that can delay, for example, the onset of ejaculation. The other thing which we often prescribe that they do is to wear a device, a condom device, that reduces the sensation of the genitalia, so that ejaculation can be delayed, as it were, so that it can be achieved in a much prolonged period than the shorter period that they are accustomed to.
Yeah, and for any relationship, Doc, maybe you can highlight, I know this can easily be highlighted by a psychologist, but what is the impact of premature or early ejaculation for any relationship? Does it affect in any way?
It leads to bad relationships. It affects relationships adversely, because you see, for sexual relationship to occur, it has to be mutually satisfactory. For sexual intercourse to occur, it has to be mutually satisfactory to the partner, the two individuals involved. So this adversely affects because the other partner does not feel valued or appreciated if this person is having premature ejaculation. So that adversely affects the relationship.
Yeah.
It can lead up to breakups in the relationship, or just a poor relationship. Yes.
And just explain to us what exactly happens within the body of a man once they have a premature ejaculation, and how you've said how it affects relationships, but what exactly happens? What happens that it hinders now the sexual activity from happening? What is the relationship between the premature ejaculation and the sexual activity?
Premature ejaculation is just basically the termination of a sexual act that is meant to take a certain period of time and in the long run be mutually satisfactory to the partners involved. And when the arousal comes, there's transmission. This message is transmitted through different forms. It is psychogenic through the mind. It can be visual. It can be due to maybe some smell or something like that, or even just auditory, meaning through sounds. But by and large, when it occurs and causes ultimate stimulation, there's transmission of neurotransmitters, release of neurotransmitters at the nerve junctions. The nerve is a conduit, but it's joined to another nerve through like a junction, so that it's not a very long conduit that is prone to damage or to malfunction. There's something called synaptic junctions. The transmission across those synaptic junctions is facilitated by neurotransmitters.
Yeah.
Therefore, if those neurotransmitters fire rapidly, then that leads to premature ejaculation. That is the end product of a sexual act is ejaculation. That is like the climax, when the process known as orgasm is reached. But if this occurs quickly, then it means those neurotransmitters are released and the end product is achieved. So that firmness of the male genitalia that is conducive for a sexual act is lost. It becomes now less firm, less rigid. It becomes flabby and dysfunctional for that moment until it's achieved again at another point.
Yeah.
Yes.
And is there a way premature ejaculation can be prevented?
Yes, like I said, it's psychogenic. So we need to deal with the psychological stimulus, the stimulus that bombards the mind. We have to deal with, the victim has to deal with that stimulus to be able to accommodate it, to be counseled, to be taught ways of avoiding like adverse stimuli, for example, or being able to cope with it. And they can also be given, like I said, medication for them to be able to cope with it so that it does not lead to preterm ejaculation. So psychotherapy or counseling or trying to tame the victim's mind is very important.
Right. And sexual dysfunction in men is a topic of discussion today. Some of the issues or disorders that we are looking at is premature ejaculation and also erectile dysfunction. We'll also be having a look at some arousal disorders that there are for sex. Talk to us, use the hashtag #MyDoctor to talk to us on Twitter at Ebru TV Kenya at Purity_Museo. Now, Doc, we have talked about premature ejaculation, but now let's get to the erectile dysfunction. I know you had already defined what it is, but once again, tell us what erectile dysfunction is and what are the possible causes.
Yeah, thank you for the question once again. I did say in the working definition that erectile dysfunction is failure to achieve and sustain. Those are the catchwords: achievement and sustenance. To achieve and sustain sexual arousal or an erection that is commensurate with satisfactory or mutually satisfactory sexual intercourse between the partners involved. So when somebody fails to sustain it, to achieve it first of all, and to sustain it.
So you can achieve it,
yes,
but fail to sustain it.
Yes, you can achieve it, meaning you can achieve it for just a few seconds or a short spell of time. And when you lose it after such a period, it is not going to be mutually satisfactory to the partner involved. So failure to achieve and sustain. So achievement, sustenance, and that it must be mutually satisfactory to the other party involved.
Yes, the causes for erectile dysfunction.
Causes are quite many, and I'll just organize them in a way that can easily be remembered. One of them we have said it overlaps with other sexual dysfunctions already mentioned, but let me just mention them and then elaborate a little later so that it's easier to remember. The first one is psychological, the one we call psychogenic. The next one is to do with blood vessels. It's called vasculogenic. Vasculogenic is to do with blood vessels. Number 3 is to do with neurogenic. Neurogenic is to do with nerves or neurons, the brain, the spinal cord, and the peripheral nerves. They come under that category. So number 3, like I've said, is neurogenic. Number 4 is drug-induced. There are certain drugs that are harmful, are used for treatment, but as a side effect, they may lead to erectile dysfunction. Number 4 is social habits. Social habits such as cigarette smoking, alcohol consumption, chewing some other substances for social functions or occasions, which may be harmful. And then last but not least is socialization. Product of socialization, either from upbringing or from when one is in the society, there are certain bad social habits he may pick. So social habits can also, other than cigarette smoking, there are certain like religious habits which may hinder sexual function. So those come under social categories, social dysfunctions. And then we have genetic disorders, some genetic disorders that somebody is born with a certain condition that does not allow him to have an erection. And finally also, certain illnesses, general medical illnesses, like it's been found out through research carried elsewhere, that if somebody has uncontrolled ulcers, uncontrolled arthritis, arthritis disease of the joints, ulcers of the stomach or the digestive system, uncontrolled ulcers, uncontrolled arthritis, or if there are other conditions, for example, like high lipid levels or cholesterol levels, or even allergy. Allergy which is not treated can also lead to erectile dysfunction. So allergy, arthritis, ulcers, some of those conditions, so medical conditions.
Yeah.
So in a nutshell, let me summarize and say as follows: psychogenic, number 1, vasculogenic, to do with vessels, neurogenic, to do with nerves, drug-induced, socialization, poor socialization, medical diseases, and genetic, things that somebody is born with, the condition that someone is born with.
And so, Doc, I'll ask you, who is at a risk of getting or having erectile dysfunction in terms of age?
Age, generally erectile dysfunction can affect any person, any age group, but basically it tends to affect the older age group. It tends to be age-related. And let me divide this age into 2 categories and say that those below 50, the cause is mainly psychogenic. It's just to do with the mind gone wrong if they're under 50 years. If they're above 50 years, then there are organic causes. Organic causes meaning that there are some medical conditions or disorders that one may pick up. Like, for example, if the heart is malfunctioning, the kidney is malfunctioning, the brain is malfunctioning, etc., etc. Those are called organic conditions that may affect those systems, medical disorders that may affect those systems. So those ones tend to apply in the 50-year-olds and above. But the ones who are younger, it tends to be psychological or psychogenic. But by and large, if you look at both categories, the under 50 and the above 50, generally the older one is, the more likely is going to be afflicted with this condition.
Let's look at the risk factors. You talked about the social habits such as smoking. Are they some of the risk factors for erectile dysfunction, and do we have more? Yes,
there are others like obesity. Generally speaking, if you see a very fat individual, with due respect, they tend to be poor performers. Because when they are fat like that, it means that there's a lot of cholesterol in them. The cholesterol that is coating the blood vessels and thereby reducing the lumen, the internal structure of the blood vessel is destroyed by cholesterol. So when the blood vessels are coated with cholesterol, the circulation to body systems, to the heart, to the liver, to the genitalia, is also going to be correspondingly affected. And therefore, if you see somebody with a lot of cholesterol, then it's likely to be affected. The other condition is high blood pressure. High blood pressure because the blood is flowing at a very high speed in the vascular system. It tends to destroy the structure, the wall, or the blood vessel, making it very thick to be able to stand that pressure. In the process, it reduces the flow, not only to those organs I've mentioned, but to other vital organs like the reproductive system. The other conditions are like diabetes. Diabetes, again, is a very common condition. It's one of the leading causes of kidney failure. And it can also lead to failure of erection because it also affects blood vessels. It affects blood vessels. It affects the performance of the tissues in the male genitalia. There's a very important tissue called cavernoso tissue. Cavernoso tissue is that spongy tissue that relaxes and contracts during the process of sexual function. So that relaxation and contraction is affected by very high sugar levels in the body. So those are some of the conditions, the medical conditions, that could lead to erectile dysfunction.
Yeah, let's also get back to the social habits. Let's put more emphasis on the social habits that could lead to erectile dysfunction.
Yes, social habits, and it's very common wherever you go, you see people on a binge of alcoholism, they're taking alcohol. Okay, alcohol may be taken in moderation, but if you take it in doses that you cannot be able to deal with, then it becomes poisonous, not just to body systems, not just to the brain, to the nerve function, but also to erection, because erection is going to occur through the intervention of the nervous system. So alcohol impairs. The desire will be there, but the performance is not going to be there because of too much alcohol in the body system.
Yeah.
It makes somebody weak. He may have the desire, yes, but then he will not be able to perform. So alcohol is one of the leading causes. Alcohol can also destroy the liver. And there are some vital hormones which are metabolized in the liver. They will also be affected, and somebody will not be able to perform.
Yeah.
Alcohol also destroys the brain, destroys the mind, the sense of judgment, the sense of appreciation. So that again may affect a relationship. And remember, for satisfactory performance, one has to have a positive relationship before these other products of that relationship can be called into play.
Yes.
There are some substances that people chew, like Mira, for example. Mira is notorious for causing some two common side effects. It causes insomnia or lack of sleep. So the body has not slept, it is not relaxed, the mind is not at peace, so erection may not come. Mira also may reduce the libido. So you find the fellow is awake, but he cannot perform. Some drivers, for example, of long distances, chew Mira in an effort to stay awake, but in the process they will lose erection in the long run. So substances like alcohol, Mira, I've mentioned cigarette smoking, may affect, and alcohol may affect erectile function.
Yeah, and in studio we have Dr. Willie Otele, urologist, helping us understand sexual dysfunction in men, how they can be addressed, and some of them use the hashtag My Doctor to talk to us on Twitter at Ebru TV Kenya and at Purity_Museo. When we come back, we'll also be having a look at the issue of overweight and erectile dysfunction. First, we are taking a quick breather. And welcome back to the second and the last part of the show. Remember, we are talking about sexual dysfunction in men. And in studio, we have Dr. Willie Otele, who is a urologist, just helping us understand how some of these dysfunctions could be addressed. Welcome back, Dr. Otele, to the second part of the show. And before, you had mentioned the issue of obesity and erectile dysfunction. Let's just stay with the issue of overweight and erectile dysfunction. What's the relationship? Because one of our viewers is asking whether the issue of overweight again may reduce the size it affects, or the size of the sexual organ. Just tell us about the misconception about the issue of overweight and the dysfunction.
It is true that overweight is one of the problems that can lead to sexual dysfunction. And the basic concept here is that when one is overweight, it means he has a lot of cholesterol. There are different families of cholesterol, and there's one family called low-density cholesterol. Low-density cholesterol is the culprit in this case of all the different families of cholesterol. So this tends to coat the blood vessels, to paint the inner lining of the blood vessels, thereby reducing the blood flow, not to just vital organs like the brain, the liver, the heart, but also to the male genitalia. And once the blood supply is curtailed, then the erection, the stimulus, is going to be minimum, because the stimulus comes through blood supply, hormone supply, and nerve stimulation, and of course psychological stimulation. So overweight is very important. It's a very important cause of erectile dysfunction. And then there's also this conception that the genitalia is going to be indrawn or withdrawn in size because somebody is grown so rapidly and the genitalia is not growing with the tandem. The deposition of fat is for the rest of the body, but the genitalia has not gotten a fair share amount of that adiposity of fat. So it tends to be reduced in size if you compare with the rest of the body. So that may be the situation obtaining.
All right, now let's have a look at some of the signs. Do we have, earlier on you mentioned that for premature ejaculation, if it's not lasting for more than 2 minutes, then that could be a sign, or that could be defined as premature ejaculation. But now you're talking about sustaining and achieving erectile dysfunction. Do we have some simple signs and symptoms for this problem as well?
Yes, there's what we define as a normal sexual relationship. Normal sexual relationship amongst couples who are staying together, who are living together in a harmonious relationship is defined as 2 sexual intercourses in a week. So if it is less than that, then it means that there's something that may be a warning sign. I want to say also from the outset that sexual dysfunction may be a sign of an impending cardiac problem, heart problem. The risk factors for heart problem are the same as the risk factors for erectile dysfunction. So you may find that one may have an erectile dysfunction as an early warning of a heart problem, or may even just have a heart problem, but beyond the heart problem, the next thing would be erectile dysfunction. So basically the main thing is getting out of the normal sexual relationship. It means that there's something that is on the way that may be impending, that is going to happen. So outside the normal sexual relationship of at least 2 contacts per week. Yeah. Okay.
Now you're talking about 2 contacts per week. Let's now talk about the problem of the sexual desire disorders. I know there is a relationship between sexual desire and the real act. So what leads to that? The sexual desire, some people will not have the desire even once in a week. Is it a problem as well?
Yes, it's a problem, and it is related to a lot of psychological factors, like the relationship between the partners, the stress levels, for example, how is his work program, like what is occupying him. He may be having lots of problems that are leading to stress. He may be having maybe a crowded work program, or the environment is not relaxing, or even just a relationship between him and the partner may be at fault. So that may be contributing less arousal, that puts him off, or that these people constantly suffer from a condition known as performance anxiety. If they just imagine that they're going to be involved in a sexual relationship, they get very anxious, and in the process they may fail to be aroused and to perform. Yeah.
And one of our viewers is asking whether 2 minutes, you talked about for the previous discussion on premature ejaculation, it should not be less than 2 minutes. So they're asking, you mean 2 minutes is too short?
Yeah, 2 minutes is short. It's not supposed to, because you see, the stimulus in the partner, in the female, takes a longer time to achieve. And then also to abolish that stimulus takes a correspondingly longer time. For a man, arousal is quicker, and it's also relatively easier to lose that arousal compared to a male partner. Therefore, this should not be very short, because you see, if it is short, if it's as short as 2 minutes, then it means that the female, the partner, is not getting satisfaction from that kind of sexual relationship. Because generally the stimulus takes a longer time in a female, and it takes also a longer time to achieve and a longer time to abolish or to lose.
Maybe you can help our men understand, when you talk of a longer time for female, how long are we talking about?
We are talking about like over 10 minutes, 10 to 30 minutes for some of the females. But at least from 10 minutes, okay, there are some who may get the arousal quickly, but generally an average of 10 to 15 minutes. But for a man, we are talking about arousal in terms of seconds. So he should program himself such that he does not lose this arousal, because his partner is taking long to achieve that arousal and will take a longer time also to lose it. So the partner, the male partner, must program himself to align his arousal and loss of the same to that of the partner, so that he doesn't appear to have gotten it so quickly and lost it again quickly at the expense of the other partner, who also has a right to have some measure of satisfaction.
And I think it's important that you help our men understand that, because some men will translate the fact that you're not getting the arousal, then it means maybe you don't love that person. Now just help them understand that it's different, maybe for men and for women. Is it different? Because some men expect, once they are aroused, they expect the same thing should be happening with their partners.
Yes, I think that's a misconception that the men have, because you see the female reproductive cycle is very complex to understand, and it's very complex if you compare it with that of the male. Remember, the women are the ones who carry pregnancy, the women are the ones who have menstruation. So all those, the pregnancy, menstruation, affect, there's some hormonal variations that come to bear, they come to have an influence on sexual function and arousal. It's not like a man which is like constantly there, unless there are other factors, medical or otherwise, or social. But generally they are less complex compared to a female. So the man then needs to understand that his pattern of arousal is different from that one of the female, and needs to align his pattern of arousal and performance with that of his partner, so that it doesn't take it like both of them would achieve a quick arousal and lose it the way the man does. So a man needs to really understand the mechanism involved, the different hormonal processes, the different physiological processes involved in the female, which are very complex. It's difficult to achieve arousal, and then also difficult to lose it. It needs to be nurtured, and then it needs to be put to proper use rather than ignored or not valued.
And Doc, what happens if the opposite is true? The lady, the woman is aroused first and the man is not. Do we have some triggers? Is there things that you would address or you would advise the couple to do to just ensure, if it's a lady who is aroused first, then what does she need to do for the men to be at the same position? And if it's a man who is first aroused, then what does he need to do to just ensure also the lady is in the same position? Right.
I think it's just to cooperate and behave like you are team players. You are playing in the same league or same team. That this arousal should be mutually beneficial. That if one feels aroused, then he should try to achieve the same in the partner, to be patient, to be tolerant, to be understanding as it were, so that it works for both of them. Because it would be adverse if it only works for one party and it doesn't seem to work for the other party. So that one needs to be patient, because this is like, it's just not like a menu that is worked out for you and given to you. One has to work for it, has to put in some ingredients, has to work for it to bring it to that level that is satisfactory, and then of course consume that same menu instead of like rushing into it and maybe it's not properly made. So a partner needs to understand, and born out of this relationship, then one needs to understand the partner so that he can understand their habits, their patterns of arousal, what goes, the ingredients that go into, so that at the end of the day they are working at tandem. They're kind of programmed to go together. They may start it at different times, but then if they program each other with a lot of due understanding, mutual understanding, and mutual respect, then it is possible to achieve the same.
And I'll also ask to just help us and understand the treatment for erectile dysfunction, and number two, whether the problem could be prevented and how.
Yes, let's start with prevention, because as doctors we are trained to find easier solutions to problems. So I should not wait to solve a problem, but I should prevent it in the first instance. So prevention is very important. Like they say, prevention is better than cure. So how do we prevent these kind of problems? So psychotherapy, counseling, giving advice, avoiding toxic stimuli, the stimuli that would hamper the performance, things that will lead to depression, to anxiety, to such other factors like stressful moments. And then also psychotherapy. There are people who are not well socialized, they need to be talked to. Our social system, unfortunately, it broke down along the way as we became more civilized. But in the past, as you grew up, you had some senior members of society, like your grandparents, talking to you about sex, about sexual performance, kind of thing that you don't see today. So the best thing is to prevent. There are other social habits that need to be prevented: avoidance of alcohol, avoidance of cigarette smoking, chewing tobacco, chewing marijuana or smoking marijuana, mirror, for example, taking alcohol, for example. Taking alcohol if it's not done in moderation, for example. So those bad social habits. Drugs also that can affect, like psychotropic agents, drugs that are used for treatment of problems of the mind, antihypertensives, for example, drugs for high blood pressure, drugs also for erection, for example. Paradoxically, they are meant to treat erection, but again, they can turn against you and fail to give you that same erection that they seek to give. So to avoid a toxic stimulus would be the philosophy here. So that is among the preventive measures. If everything else fails and the problem is there at hand, then it has to be confronted and a solution worked out, or the problem solved. And how do we solve it? Again, we still go back to psychological. We need to do psychotherapy, and in combination or exclusively, if it's a good response is achieved through psychological counseling, then one does not need to use medication, or one can use medication in combination with psychotherapy for effective therapy. So there are some drugs that can be used. There's some drugs that can be used in form of tablet, in form of even nasal spray. You can just spray it in the nose, and it can work. You can also use it as a patch. You can just patch it on the skin like a stamp or a tattoo, and then it can also work. Or even injection in the body of the male genitalia. You can actually inject it, and you achieve an erection, for example.
Yeah, and Doc, I'll ask you, there are some people who use some drugs, which I know you are aware of, to just boost their erectile ability. Would you approve of them?
Yes and no. Yes, if they are medically indicated, if there's an expert who has seen this patient, a doctor has seen, a physician, a urologist, they have evaluated this patient, because some of the drugs can cause adverse effects. Some of the drugs, for example, can affect the cardiovascular system. So it's important that you find that if the patient is best suited, the client is best suited to use of those drugs, so that they don't turn to be adverse to the health of the person. Many occasions, somebody's taken those drugs and have just collapsed in the process of consuming or using those drugs. So yes, they can be used if medically indicated, if somebody's been evaluated and a physician.
They just use them on their own will. They
Yeah,
just want to
using
boost
on their own will is not recommended, because they may be adverse. In fact, there are different categories suitable for different categories of patients. They are not suitable for all the clients or the patients across the board. So yes, they can be used, but they may also be adverse if they're just used injudiciously. Yeah.
Okay, and there's one of our viewers who is asking a very hard question for me to ask, but I'll try ask the question. They are asking sometimes the couple would want, or a partner, especially a man, would want a very quick sexual activity. Is it a problem?
Yes, a quick sexual activity should not even be the practice, should not be the norm, because sex is supposed to be something that is involving two parties, and that the two parties are equal to that act, and that the two parties are equal participants, and that the two parties have equal rights, and the two parties have equal obligations. So the question of saying they want a quick one, a quick act is like is a thief, he's going to steal or is taking unfair advantage. Okay. That should not occur in a mutually satisfactory relationship. Unless maybe has some pathological or some abnormalities. There are those people who have those abnormalities, like when they come to the house or office or wherever they meet a partner, they're going to engage in a sexual act without looking at the environment or looking at the circumstances obtaining. So that should not be the norm.
But once in a while it's fine?
Well, it depends on what you define as your norms in a social setup. But medically speaking, we think that this should be in an environment that is conducive, in a manner executed in a manner that is mutually satisfactory to the parties, the two parties involved, so that the other one doesn't appear to have taken unfair advantage.
Yeah. And we want now to shift our focus on sexual pain disorders, unless you have anything left for erectile dysfunction.
Yes, I still have something that I was talking about to do with the medical treatment. Medical treatment goes beyond drugs, beyond the patches, the powders, the sprays, the tablets, the injections that I've alluded to. We have some operations, complex operations, which can also be performed. We can do an operation known as penile revascularization. So if the blood supply is diminished, we have a way in which we can borrow blood supply from a nearby major blood vessel and divert it to the penis, or share the organs which are around there, which can share that blood supply to the male genitalia that may be starved of that blood supply. So we can do an operation to divert some of that blood, borrow a blood vessel. There's some blood vessels which are also not very critical to human function or survival, which can then be diverted to the penis. So that is called penile revascularization. And if everything else fails, and this one that I'm mentioning as an option of last resort, where we use like a prosthesis. A prosthesis is something like an artificial penis, something that supports the real penis, an implant as it were, and there's some penile implants which can be used, and they use a vacuum device. The vacuum device is fitted somewhere very convenient so that it can like pump, like a cuff, like a blood pressure machine. It puts pressure on it, and then it can generate some erection. So that penile implant is one of the options. Is
it a temporary erectile dysfunction? Is it a temporary problem, or would you say to some cases it could be permanent?
Many, to a large extent, is temporary.
Oh.
Yeah, but a few cases are permanent, and those permanent ones are the ones that now we resort to use of a device. And then we resort to use of a device basically for people who are like much senior, not very young fellows. For young fellows, we want to try the softer options. But if everything else fails, the penile implant or the pump, as it were, is an option of last resort.
But how do you address the stigma that may come with failure of failure of the erectile activity, the fact that we are in an African setting, and now the man will have to use some implants to just boost their erectile functioning? Yeah,
the stigma is very difficult to deal with, because sometimes it comes from partners. You see, like a partner may not be performing very well, and then they pick up a quarrel over some issues, and is reprimanded in very good time, that very promptly, that you are not a performer, or despite these kind of things you are doing, you don't perform, you know. And if that kind of thing is said somewhere that is not private, then people get to know about it, and it causes problems because now the person loses self-esteem because other people get to know. For us on our part as doctors, we tend to keep that information confidential because, you see, as part of ethics, the information appertaining to the sickness of the patient, no matter what it is confidential between you and the patient. But at social level, you never know what the other spouse may end up doing in terms of leaking that information, because sexual matters are usually very private, but sometimes they leak in public domain, mainly because of the spouse of relationship that have gone sour, and then this information goes into the public domain. So that affects the esteem of the person. So one has to treat it with understanding like any other illness, and deal with it with due cooperation instead of making like a scandal or an issue out of it that other third parties may get to know.
And let's now finally talk about the sexual pain disorders. What causes that and how can we address it? Yeah,
there are some conditions where, for example, somebody has a sexual arousal that fails to go away, that is prolonged. And then we say that the sexual arousal, if it lasts more than 4 hours, and that arousal is prolonged more than 4 hours, and it's not associated with sexual desire, then it becomes pathological. There are people who have a condition known as priapism. Priapism is that condition I've described, whereas arousal has occurred and is lasted beyond a normal period. So it should not last more than 4 hours, but this one has lasted more than 4 hours. And it's not associated with sexual desire. But again, there are ways of dealing with it. It can be, there are medications that can be given to abort it or reduce it in form of tablets, in form of injections. We can inject into that penis and aspirate and put in some, aspirate blood and put in some medicine to reduce that erection. If that fails, there's some operations that we also do to reduce, because basically when that erection is prolonged, the penis gets engorged with blood, the blood forms clot. So as part of the therapy, we have to evacuate, remove that blood so that the penis goes back to, is restored to the normal physiological state. So that is one of the painful arousal. Sickle cell, there are children who are born with abnormal hemoglobin, where the blood vessels are very fragile, they break down. They break down and they form debris or sludge in the blood vessels. So that can cause blockage of the blood vessels in the genitalia and cause an abnormal erection. Again, that sickling disorder, there are ways in which it can be prevented, there are ways in which it can be treated. So once we treat the primary condition, then, okay, it's not curable, but you can control it. Then that erection, which will tend to be coming from time to time, can be abolished. So that erection is prolonged, it's painful, it's not in keeping with the sexual arousal. Yeah, so that's one of the common conditions that we see. Yeah.
And those are the causes. That's why, because for some couples, there's usually pain during the sexual act. Are those the only causes for pain during sexual act?
No, not at all. Not at all. Like there are situations, back to the topic we are talking of, arousal, where the other couple is not adequately aroused or not aroused at all. So that penetration, the genital tract is not well prepared. So it's like an intrusion of sorts. So that leads to pain.
Is it pain for both partners or for the female partner?
Especially the one who is not prepared, it will be painful. But again, even the other partner will also feel pain, because it's like working against some kind of resistance in a genital tract that is not prepared. Some infectious conditions, for example, if somebody has some infectious conditions, there are different infectious conditions of the genitalia, the skin on the genitals, or just the body of the genitalia, maybe having like some sexually transmitted diseases, some ulcers, which may cause pain. Yeah, but one of the things that can also not be wished away is the fact that the other partner is not aroused, so he feels pain. Women, again, they have some gynecological conditions. There's a condition known as dyspareunia, which is painful sexual intercourse. It's a whole topic. I'm sure one of my colleagues will talk to you one of these days. But again, that condition can also lead to pain during intercourse.
Yeah. And earlier on you mentioned genetical function or sexual dysfunction related to genetical factors. Now, people born with the erectile dysfunction, it's one of our viewers who is asking, can they get help?
Yes, people born with erectile dysfunction, there's a lot of help on the way. First, we like to know if this is genetic, if somebody was born with it. There are certain tests that we can do. We want to know if the hormones, for example, are up to date. The reproductive hormones. There are some hormones which come from the gonads, that is the testes. These hormones may be in deficient supply, maybe the testes is not developed well, or maybe there was trauma, for example. Trauma is another thing that, trauma to the organs, trauma to the spinal cord, for example, trauma to the blood vessels. So maybe trauma occurred to the genitalia, to the testes, for example, and he lost them in an accident, or maybe through surgery. There are times when we remove the male testes when they have cancer of the prostate. So once we remove, they are not able to achieve erection unless you are giving them alternative medication to achieve erection.
Yeah, and just go ahead.
Yeah, so the testes may have been traumatized, or the person was not born with them, or they had an infection like mumps. The mumps is a disease, a viral disease that affects the parotid gland, the parotid duct, and it also affects the testes in the process. So if a child suffers mumps, especially if it came later in childhood, it's likely to complicate and destroy the testes. So maybe there's an infectious problem, like the one I've alluded to. So you find that the hormone output is low. There are some syndromes also, there are some genetic disorders to do with the brain. Like the glands, there's a master endocrine gland called the pituitary gland, which is at the base of the brain. The pituitary gland, again, may fail to develop, or may have abnormal development, so meaning that it has low output, or it might grow a tumor there, for example. A tumor in the pituitary gland, known as pituitary adenoma, may be leading to yet another hormone called prolactin. Prolactin is a hormone that opposes the testosterone, which is a male hormone which comes from the testes. And then there are also some signals called luteinizing hormones, which also come from pituitary. They come down to stimulate the testes. So those signals, stimulatory signals, may also be abnormal in function. Maybe they are not produced in sufficient amounts because the area where they're coming from, the brain, failed to develop in the first place. So those are some of the genetic disorders. Like there's a child who is born, and the ones they describe as eunuch, because these systems did not develop, these endocrine glands developed abnormally. They have chromosomal disorder. The chromosomes are abnormal, for example. If we check those chromosomes, we can be able to pick up. So the most important thing is to analyze, look at that person and see, is this something that can be reversed, or is this something permanent? If it's reversible, then we look at various options. What is basically causing it and what can be done to reverse it.
And Doc, we have less than a minute to wind up, but I'll ask you just one question. One, is there a way you can tell that your boy child will have a problem in the future? Is there a way you can pick it up that, you know what, I think my boy has a problem or will have a problem with erectile dysfunction, and also leave us with a few tips on how do we protect ourselves from finding ourselves in such situations?
Yeah, back to the boy child. The boy child is very easy to know. When a baby boy wakes up in the morning, he should have an erection in the morning. When he goes to sleep, he sleeps soundly, but as he prepares to wake up in the morning, in the early hours of morning, then that erection comes on. So that observation is an assurance that is not going to have erectile dysfunction. But if he wakes up in the morning and he has no erection, he has never had any, even as a little boy who is just been born, that erection occurs as much as even it occurs in a grown-up person. By the way, even grown-up men should have that morning erection as a sign that things are okay. If that erection is not there, that is one of the warning signs. Early morning erection, even as doctors, as physicians, as urologists, we would like to ask to interview in the interview with the patient whether they are having it because it's of significance. So it will also be of significance in the boy child when he's growing up early in the morning, so the mom can observe it and know that things are okay.
All right.
Yeah.
Thank you so much. That's all the time we had for the show, but it was quite important to discuss it. We are looking forward to having you once again on My Doctor Show. And thank you so much for watching. That's all the time we had. Of course, the show continues tomorrow or next week, every Monday, Tuesday, and Wednesday. We are here to just help you with quite health information. You can always download our previous episodes from our YouTube channel. Just go to Ebru TV Kenya or Purity Museo and download the episode of your choice. My name is Purity Museo. Goodbye.